Hi, I am Dr. Prashanth Jain. I am an arthroplasty surgeon. So, shoulder dislocation, wherein the humeral head comes out of the glenoid cavity, which is very common in young adolescent people during their sporting activity, and it is also seen in some kind of traumatic condition. If the shoulder dislocation is happening repeatedly, say more than 2 or 3 times, it is called recurrent shoulder dislocation. There would be some anatomical changes which will be happening in the joint, which is the reason for this recurrent shoulder dislocation to happen. So this issue we evaluate with an MRI scan and a CT scan to know what is the ligamentous problem and a bony problem. If it is more of a ligamentous problem, it can be addressed by what is called Bankart's repair, which is done by a keyhole surgery called Arthroscopic. And if there is a too much of bony component involved in that, then it can be again treated by a bony procedure, which can be arthroscopic or a open, called Latarjet Procedure. This can definitely completely fix your recurrent shoulder dislocation problems. So post-surgery, proper rehabilitation helps in regaining the complete movement, and cuff muscle strengthening helps in further success of the surgery. So many of these patients who undergo shoulder arthroscopic Bankart repair or Latarjet procedure can get back to their normal sporting activity like throwing, bowling or swimming. This can be done post-surgery.